Multiple sclerosis is an immune-mediated inflammatory demyelinating disorder of central nervous system which affects both the brain and the spinal cord. The cause of MS is not known. It is likely a combination of genetic predisposition and some kind of a non-genetic trigger from the environment, for example, like a viral infection. It results in immune disorder which attacks the central nervous system on a recurrent basis and causes a lot of signs and symptoms and neurological impairments. So in terms of signs and symptoms and neurological impairments, it can result in physical, cognitive and psychological issues for the patient. The main physical problems that the patient can have is muscle weakness, sensory symptoms like pain and numbness, problems with balance, issues with swallowing and speech. Common symptoms also include headache, tiredness and fatigue, and the list goes on. So if we talk about how it affects cognitively, the patient can have problems with memory, attention and perception. And in terms of psychological issues, it can have issues with mood, problems with adjustment and initiation. So it is a challenging condition both for the patient and the supervising team because it is a lifelong condition. It has no cure. It is a progressive disease with multitude of clinical manifestations and it has got an unpredictable course. So all these factors make it very challenging. It also produces a multitude of signs and symptoms, as we talked about, physical, cognitive, and psychological. So there are three main elements of managing this condition. The first one is early diagnosis. And the early diagnosis is important because the sooner we diagnose this condition, then we can start the intervention. So the second aspect is early intervention with medication. And there are broadly two types of medication that we use for MS. One is the disease-modifying drugs. These are the drugs which are not curative, but they control the disease and delay the progression of the disease. And it is important that the patient has access to this medication very early on. The second group of medication that we use is the drugs that we use for symptom control. So if a patient has problems with pain, stiffness of the muscle, fatigue, problems with bowel and bladder, we have very effective treatment for those symptoms. But as a rehab physician, I would think that the third element is equally important, if not more important, and that is for the patient to have access to rehabilitation facilities and social support. So the patient should have access to a multidisciplinary team of professionals, which would include rehabilitation physicians, neurologists, physiotherapists, occupational therapists, speech and language therapists, and neuropsychologists. And also the patient should have access to rehabilitation at all stages of the disease and in all settings. So the access to outpatient rehabilitation, inpatient rehabilitation, and also rehabilitation in the community at home is very important for MS patients.